7, identification of skin types. The oil in the body is actually secreted through the skin. If your client's dietary choices include a lot of oilier food, this might exacerbate, or it might even be the root cause of their oily skin. And this might be true of T-zone oiliness too in clients. Additionally, if food sensitivities are there, these actually might cause the skin to overproduce lipids as a reaction to expelling those toxins from shellfish sensitivity, nuts, or other food sensitivities. That's what happens in my case. I cannot eat peanuts. And what you might want to do is suggest that they limit fried food, oily foods, and maybe some nuts like peanuts or peanut-based foods so that you can test their sensitivity. They could also go to the doctor or an allergy specialist and do skin patch test, which is a great suggestion. Send them over to a medical professional, which in turn will help you with ingredients for skincare. One skin rejuvenation cycle is what you want to test these sensitivities through. And what you want to do is take photos throughout the process so that in this period you can mark any changes and make sure that you're documenting. Combination skin is the next skin that we talk about. Combination skin includes areas that are dry as well as oily. This is most commonly known as T-zone skin, and that's usually where the T-zone is where the oil is being produced. The actual cheeks tend to be drier than this area here of the forehead, nose, and chin area. As the name implies, combination skin has oily and dry characteristics, and therefore it's quite a bit more difficult to control. For skincare coaches, it's also a challenge to choose ingredients and products for clients that work in combination skin. For example, some people who have an oily T-zone on their forehead and nose and dryness on their cheeks, others might have dehydrated skin that's breakout prone on the sides of their face, and the chin area and the rest of their face is fine. Learning the skincare requirements for every part of your client's face can help you address their issues most optimally. In fact, we recommend that you segment the areas of the skin and the face and address them separately as part of your skincare coaching conversations and recommendations. A segmented approach, at least until their skin is a bit more balanced, is often the best course of action. For example, if you identify that their cheeks are prone to dryness, then you could address this issue by suggesting a cleansing and moisturizing regime that's a bit different for the rest of their face that's more naturally oily in the T-zone. The good news in this case is that if you focus on serums and moisturizers as the primary area, you can quickly start to make progress and then extend this to the rest of the areas of their skin. Most important, making sure that you teach the client that combination is a combination of different skin types and that the areas should be treated differently for optimal results might help them understand why some of the products they've been using on their entire face might not be working for them. It's not that the products weren't good, it's that they needed to be segmented and use another product for the oilier or dry areas. This makes perfect sense when you think about it. Plus, the clients might have been seesawing back and forth between products that were perhaps good for oily skin or too drying for the rest of their skin, and that's a problem with these areas. Or they might be moisturizing for the oily areas, causing even more problems in those oily areas. So segmenting the skin is the way to go. It's entirely frustrating because the client might say that they loved how the cream they were using worked wonders on their cheeks, giving them a fabulous healthy glow, but that around their nose they got more whiteheads and enlarged pores than before. So frustrating. By segmenting and just adding a few tweaks, by not moisturizing the nasal area or the chin, or changing out their serum in that area to use one with perhaps 5% niacinamide, you might stabilize and get their gorgeous skin combination skin looking absolutely fantastic. If you remember, topical niacinamide can actually inhibit the production of oil, which is beneficial to people dealing with acne or oily areas of their skin. But it does the same for skin that's already dry. So what makes it a great option for the oily areas might make it downright terrible for people who actually apply it indiscriminately to the areas of their skin that is more combination on the dry side. By warning them that the same 5% serum used on their cheeks might have absolutely become a destabilizer because that area is drier and therefore very different in its treatment needs, you'll be doing them a great service. This conversation is vital to the success of your coaching assignments with combination skin clients. And believe me, it will open up their eyes, making more sense, and most likely help them change their skincare habits and their regime in the best possible way for the rest of their lives. Now let's talk about skin sensitivity. Sensitive skin is a term that defines skin that's more prone to negative reactions, redness, blemishes, or inflammation. While there are several diagnosable types of sensitive skin like rosacea and acne, people with sensitive skin simply react stronger to certain products and stimuli than those with normal skin. In addition to the 4 basic skin types, your skincare coaching program should ideally classify your client's skin according to a sensitivity range from normal to slightly to extremely sensitive, and finally make note of any allergies or allergic reactions that they've experienced. Sensitive skin is often referred to as a skin type, but your client can have oily and sensitive skin, dry and sensitive skin, normal and sensitive skin, or combo and sensitive skin. So it's more like a reaction or a condition than a type. If your client has sensitive skin type, be very careful about the recommendations to try new products, especially when it comes to certain chemical products like benzoyl peroxide, salicylic acid, retinol, which actually stimulate the skin and can cause irritation. Regardless of which type of skin your client has, if they have sensitive skin, it might feel red, feel like it's burning, itching, or dry. These symptoms may be related to having skin that's more vulnerable to external irritants, and these might be triggered by certain ingredients like dyes or fragrance, or might be according to some environmental factors. If they get too hot or too cold, their skin might flush, or if they eat something that doesn't agree with them. If your client's skin is sensitive, you may be able to determine what triggers their sensitivity by narrowing down potential irritants, or triggers by asking a lot of questions and using trial and error over a period of time and documentation. So what are the common triggers for sensitive skin? Your skin is reactive. If you have sensitive skin, you probably develop symptoms in response to certain triggers. Common triggers include soaps, dyes, detergent, fragrance, perfume, skincare products, and household products, as well as things that you eat. In addition, exposure to cold, heat, sun, temperature can also cause flare-ups. It often helps to use samples first for the client so that this quest for products that might help their goals but not trigger their sensitivities will not be expensive or a frustrating quest for them. Specifically, you can suggest that they avoid products containing those specific ingredients or alter their environment to reduce exposure to irritating or triggering agents. Consider making the recommendation and then suggesting that your client consult a dermatologist or an allergist to find out how to select the right ingredients for their sensitive skin. This is why the watching and waiting skin test isn't always accurate. When people ask how they can tell what type of skin they have, they might come across a test called watching and waiting. This is a premise that this test for people will have them understand what type of skin they have by just observing how their skin behaves after cleansing. Here's how it's supposed to work. Wash your face, then gently pat it dry. If after 30 minutes your skin appears shiny throughout, you probably have oily skin. If it feels tight or flaky or scaly, you most likely have dry skin. Or if the shine is only on your T-zone, you probably have combo skin. And if your skin feels hydrated and comfortable but not oily, you probably have normal skin. Well, why isn't this always accurate? Well, there's several reasons. The oil glands react based on what the skin needs in the short term, which means that this test is heavily dependent on the cleanser the person uses. The skin might be overproducing or underproducing sebum because of medications, products, ingredients, because it's stressed or recovering from trauma like sun exposure.